Hi, I'm Susan Colley, and welcome to your Disability Connection. Discovering your child is developmentally delayed or disabled can cause significant worry and sometimes despair. Early intervention is a parent's first step to receiving needed assistance. Here to discuss early intervention is Patty Forget, Acting Director, Early Intervention, Bureau of Family Health and Nutrition, and Marissa Child, Contact for the Parent Leadership Project, Thome Mystic Valley Early Intervention Center. Hi, how are you today?
Good morning.
Good.
How
Good
are
morning.
you?
I guess the first step is asking you, what is early intervention?
First of all, let me thank you for having us on, Susan.
You're welcome.
This is a great opportunity for us to talk about the early intervention program in Massachusetts. Early intervention is a comprehensive community-based program for children, for young children, infants and toddlers, birth to 3. And the goal of early intervention is to support children to become active participants in their communities and in their families. The goal for families with early intervention is to have resources available to them and supports so that they can enhance their child's development.
Right, and what do you actually do with early intervention?
So my role is to be a contact person for families who are going through a diagnosis process or have been recently diagnosed, so that they have someone to talk to and to feel more comfortable.
Great. Now, who is eligible to be in early intervention?
The Massachusetts Department of Public Health, who is who I work for, under the Bureau of Family Health and Nutrition, is considered the lead agency for early intervention in Massachusetts.
Mm-hmm.
And that means that the department is responsible for meeting the requirements of the Individuals with Disability Education Act, which is Part C of the legislation.
Right.
As the lead agency, we in Massachusetts have determined our eligibility. Each state can define their eligibility for early intervention, and in Massachusetts we've been lucky to have broad eligibility, where we serve not only children who are eligible because they have a known diagnosis,
Right.
or a known delay, but children who have who are at risk for delay because of either child or family characteristics can be eligible for early intervention in Massachusetts as well. And then we have a fourth category of eligibility, which is called clinical judgment. Mm-hmm. And that means if the multidisciplinary team that is completing the evaluation determines that the child is not meeting our level of delay for eligibility, but they have some concerns for that child and family, they can bring the child in under clinical judgment, and the child will be eligible for a 6-month period.
Wow, that's interesting, because that wasn't available years ago.
No, you're correct. We've been lucky in maintaining that broad eligibility to ensure that we are capturing children and families who are in need of our service. And in Massachusetts, we served last year over 40,000 children.
Wow.
In fiscal year 17. So
Wow.
It's a pretty big system.
So what is the meaning of developmental delay? That's pretty broad.
It is broad. Developmental delay can present in many different ways for many different children. And it really is just not meeting your developmental milestones or
Mm-hmm.
being a little bit behind in your development. When we evaluate children for eligibility, we look at the 5 eligibility domains, which are communication, cognition, motor, personal, social, and adaptive. And so a child may be a little slower to either talk or to crawl. There are a number of things that the child is not doing that age-appropriate peers might be doing. And so those are some of the signs for early intervention for a family or anybody to call their local early intervention program and make that referral so that we can get in there early and support the family and the child in meeting those developmental milestones.
Right, Marissa, how do you handle a parent who is really upset and doesn't know what to do? How do you cope with that?
Well, the same way I had to cope with it when my child was going through a diagnosis. You have to take it one step at a time, one day at a time, and really just appreciate the child for what they are and who they are, and not keep looking too far ahead on what you were hoping was going to happen. So if you wanted your child to walk and they're not walking yet, they're not walking yet.
Right.
And you have to understand that this team is coming in to do their best job in helping that child and your family meet the goals and get to where the child will move on to the next part. So I'm just there to help support them and remind them that the bigger picture is it's going to be okay, that you're going to keep going and your child is going to do whatever they're going to do when they're ready to do it with the team helping them.
That's very good advice. So what are the first signs a parent should look for that would indicate their child might have a developmental delay or a disability?
Well, the majority of our referrals in early intervention do come from hospitals and pediatricians. So oftentimes it may be at the pediatrician's office where the pediatrician is doing either their 2 or 4 or 6 month check-in with the child and the family sharing some information where the pediatrician may be a red flag for the pediatrician to say, well, your child might be a little bit behind, you may want to contact early intervention. Certainly for those families where the child is diagnosed at birth, those children are referred immediately into early intervention.
Right.
But if a family is also experiencing a lot of other traumas or toxic stressors, such as lack of food, clothing, and shelter, domestic violence in the home, substance use in the home, the child was born prematurely, the child had low birth weight, those are other things that may make the child eligible based on our at-risk categories.
That's interesting. I mean, you wouldn't think some of that would actually affect a child. I mean, they do affect a child. That's not what I meant. But, overall, to be in early intervention.
Right. So those characteristics, those risks, through research, are known to have adverse effects on a child's development. So if we can reach those families to support them with strategies, to do stimulation, to give them ideas in their daily routines, when they're changing a diaper, when they're going for a walk, there are strategies that you can utilize during the everyday routines that can support that child and family to enhance the child's development.
Well, how does a child actually get evaluated?
That's a good question. If a parent is interested in early intervention, anybody can make a referral to the local early intervention program. It doesn't have to be a pediatrician that refers the family. It doesn't have to be a hospital. You can contact the early intervention program directly, and we have what's called a central directory, which is a 1-800 number where families can look up, based on their city or town, the early intervention programs that cover that community. They can call the program directly and just say, I have a concern, my child's not talking or my child's not walking, I'd like to have an evaluation. Once that family calls, the local early intervention program has 10 days in which to contact the family back and then schedule an evaluation. And the evaluation for eligibility is completed by a multidisciplinary team made up of various disciplines with skills and expertise. It could be OTs, physical therapists, occupational therapists, nurses, developmental specialists, etc. They do an eligibility evaluation, and in Massachusetts, we have a universal eligibility tool, which is the Battelle Developmental Inventory. So every child gets an evaluation utilizing the Battelle. If on the Battelle there are any delays beyond, we use a 1.5 standard deviation as our marker. If there is a delay of 1.5 standard deviations in any of the 5 domains that I mentioned earlier, the child would be eligible based on an established delay. If there was no delay, but the child and family met the risk factors, they might be eligible that way. Or if there was no delay, but there were some puzzling behaviors that the child was exhibiting, or questionable, what's the word I'm looking for? Qualities, then they would utilize the team's informed clinical opinion and bring the child in under clinical judgment.
Now, do you help parents go through this process?
I'm always available to help. Developmentalists from my center know that I'm there for that, and they're always welcome to give out my information for families who need it. It's their right to decide if they want to use that information or not.
Mm-hmm.
I also am in the building twice a week with my own child at playgroups.
Oh, wow.
So I will always announce myself at my playgroup and whenever other playgroups are in the building and say, hi, here's my face. If you ever need to call me, I'm always here. I'm always able to talk if you need someone to talk to.
Yeah. Do you ever go with the parent to an evaluation?
I've never done that. I have met for coffee.
Oh, well, that's good.
I've met at the park, so sometimes meeting outside is a
Outside
nice
is
way
less
for them
pressure.
to.
Yeah. We already discussed that. Patty, what services are expected from each organization that are in the early intervention?
We currently contract with 60 early intervention programs across the state so that every community, city, and town is covered by an early intervention program. After the evaluation and the child is determined eligible, the family moves forward in the Individual Family Service Plan process, or IFSP. A service coordinator is assigned to each family and child, and that service coordinator is really kind of the linchpin or the person who is responsible to ensure that the other disciplines, if needed, are involved in that child's ongoing service provision. So through the IFSP process, there is opportunities to gather information from families about what their needs are, what their concerns are, and what their
Right.
priorities are.
Right.
And utilizing that information along with the information obtained through the evaluation, the early intervention provider, along with the service coordinator, will discuss with the family what it is they want to achieve for their child while enrolled in early intervention. So a family really, the program is very family driven and family centered in that the family is the key person who knows their child the best, knows what their child is doing well, and knows what areas their child might need some additional support in. So the early intervention team takes all of this information with a lot of input from the family, and the family decides what outcomes they want to achieve. Based on those outcomes, services are identified to support those outcomes. So some children receive services in a home-based setting,
Right.
and the majority of our services, I would say 95% of early intervention services are provided in the home or
Yeah.
in a community-based setting, meaning if a child is in childcare during the day, the early interventionist will go into the childcare setting.
Oh, that's interesting. That's very thorough, I would say.
It's a wonderful thing. I work in a toddler room in Arlington, at Arlington Children's Center, and we welcome early intervention in our room at any time. They're just fantastic to have in our classroom.
Yeah, I mean,
all of the children
it's-
benefit from it.
Yeah, a person who has a child who has a disability definitely can grow, because they're integrated at the same time, but they're getting the early intervention services. So
Right.
that's great.
So Marissa gives a very good example of a community-based setting where children from the community attend as well as children from early intervention. And it is staffed by some early intervention staff will go to that site, the community site, and support the early intervention children. But it's really the peers that are involved in that program as well that are supporting the child's development that's enrolled in early intervention. So services can look different for families. In addition to home visits, we also provide child groups, as Marissa mentioned, parent education groups. We do, as I mentioned, evaluation and assessment for to just look at the ongoing developmental needs of the child and family.
Right.
And we support families with transition. But everybody's service plan is individualized, and it's based on the needs of that individual child and family.
Now, that is the IFSP.
SP, right.
Okay.
Individualized Family Service
When
Plan.
does that evolve? In other words, is it after the evaluation where they go and they meet with the parents and they get all that information?
Yep, after the evaluation, that information is shared with the parent. They ask the parent additional questions or concerns they might have about their child, and they start the individual family service plan development. The process is meant to be relational, where there's a lot of give and take with information sharing from the family to ensure that we are addressing what the family's concerns are. Legally, the program has 45 days in which to develop an IFSP with the family. from the date of referral.
35 days?
45 days.
Oh, 45
days.
days.
So the family is not waiting for a long period of time before services start. So programs are responsible to provide services within that 45-day timeline. They develop the IFSP with the family during that timeline, and then they start the service provision once the family consents to the services that are identified on the IFSP.
Right. Now, Marissa, can you tell us a little bit about the Thome Mystic Valley Early Intervention Center? I wanted to get that right. Could you tell us a little bit about that center and what it does? How does it fall in with the early intervention services and so on?
So it's a wonderful center. They have numerous playgroups that run at their actual home base on Gill Street and also in other community centers. Families are offered so many hours per week of time they can use. So usually I think it's 1 or 2 playgroups a week. And if you're able to use that, you can. And they allow so many children in with usually a certain number of developmentalists or speech therapists, social workers or speech therapists, I think I said that.
Right.
And they're all in the room with the children helping out. One of the play groups I do involves a play together, so you're playing with the child, with the specialist in the room in a group setting. And it's kind of a mini version of a classroom where there's free play, there's some structured play, but then there's some time changes where they have to clean up and maybe sit down and do some songs together and then have a snack together.
Right.
So it kind of runs through the basic steps of what they would do in a preschool classroom in a smaller scale.
Right.
And they have the therapists who are in there, and they're so wonderful, and they really take a moment with every child to connect with them and to help them do something. So maybe your child's sitting there with a horse, and they'll come over and, oh, I have a cow. Let's see what the cow and horse can do together. Can they ride up here? And they're just
That's
so
cute.
engaging. And it's not even just about the moment they have, but it's about teaching me. Here's a moment I could have with my child at a later time.
Right.
It's always reminded me of pushing another step forward in, oh, let's try something together, and not just you with a horse jumping up and down. How can your horse jump over here? What color is your horse? What's your horse going to eat? And it's engaging their play. It's expanding on their play to continue with opening their minds to different aspects of play, which is so important. Play-based learning is
Yeah, especially at that age.
so crucial at that
Yeah.
age. And then incorporating other kids in their play slowly, because at that age it's still more parallel play. But just incorporating other children and what they're doing. And, oh, can you pass this to this child? They're going to have a turn next. And
That's
it's just
great.
really a wonderful way to bridge, especially for children who aren't in a daycare setting at a younger age and aren't used to being around maybe that
Other
many
kids,
children.
yeah.
It's really a beautiful way to have your child spend time with other kids, and as a parent to have other parents. I've made some wonderful friends in the playgroups there.
Wow.
That I've carried outside of the playgroup. So it's just wonderful for everybody involved.
So the parents are there with their child.
Yes.
Okay. As I guess I was going to ask is how involved do parents get in the early intervention process? They seem to get very involved. Does anybody want to add anything else?
Sure. I would say that being a family-centered program, families are involved from day one of
Absolutely.
their child being referred. They are looked at as the key, most important members of the team. They participate in all of the IFSP meetings. They participate in the ongoing home visits. We are kind of shifting our approach to home visiting, Susan, where we're no longer, the home visitors don't come into either a community-based setting or a home visit and just work in isolation with the child. The family is there, right there, engaged with the early interventionist and the child, and we're really trying to reinforce that parent-child dyad. In addition to participating in the ongoing IFSP services, in Massachusetts, the project that Marissa is representing, the Parent Leadership Project, really tries to support families through their enrollment in early intervention and to build skills that take them through to leadership roles when their child graduates out of early intervention. So Marissa, as a parent contact, is in a key position to connect establish relationships with other families, but also to share a lot of information with families. After early intervention, we find many families will come back and there'll be representatives on our interagency coordinating council, or they'll participate in early intervention committees to help the department and advise the department around policies, around networking opportunities where we can bring parents together so that they have that connection and that parent partnership moving forward and taking those skills to become leaders after their child graduates from
It's
early
very
intervention.
true. I mean, I feel like the confidence I've gained from being the parent contact helped me start a Facebook group in Woburn for families
great.
with special needs,
Yeah.
where we didn't have one before. Just to be able to say, where do you get your child with autism's haircut? or what dentist do you use? Because those are
Right. You know,
huge.
it sounds trivial, but it's so important because I have
Very.
2 children who are autistic. And I was forever trying to figure out who to go to because who was more sensitive to somebody who had autism, you know. And back when my kids were diagnosed, you know, there wasn't a lot of professionals out there that you could go to. But now, thank God, you know, there's a lot more, you know, available for people.
One other opportunity with regard to the Parent Leadership Project is they do produce a quarterly newsletter that goes out to families electronically or in hard copy. And one of Marissa's jobs is to share that and disseminate that newsletter. And I believe we have over 5,000 people on the distribution list for that newsletter. But that's an opportunity to share, as Marissa was saying, just other resources that a family might not be aware of. It also always highlights a parent story. And
Wow.
the parent story is always translated both in English and in Spanish. So we are really trying to broaden the net and make sure that the network is there to support families to hear about early intervention and how they can be involved in their child's care.
Now, when an infant or toddler qualifies for early intervention, who pays for the service?
That's a very good question. We in Massachusetts are extremely lucky in that we have broad payers for the Massachusetts early intervention system. So there is no cost to families
Oh, that's great.
to participate in early intervention. Mass Health, which is our federal Medicaid program, third-party insurers cover early intervention in Massachusetts, and then the Department of Public Health is the payer of last resort. So families are not charged any copays or any deductibles. There is no cost to families to receive early intervention services.
Now, how long does early intervention last?
Early intervention is from birth to age 3, so right up until that 3rd birthday. And then early intervention throughout the child's enrollment assists the family in transition and to transitioning into next step services. So whether that is public preschool services, public special education preschool, or whether that's early Head Start or other community organizations, or just to identify a child care provider within the community. Early intervention programs, and Marissa, you could probably speak more to this, assist families in transitioning probably from day one, because it is a family-centered service. I think families would like to stay in early intervention until their child is school age, but our funding ends at 3, but we
Very
try
true.
to make it as seamless as possible with regard to the transition.
It is. I unfortunately did not have that support with my oldest, but I've been there with other families through that support, and it's crucial. It's such a big world to navigate when you're getting a
Yes.
diagnosis and when you're transitioning to the public school system for services, and just to have that person who they've connected with. I mean, you connect with your service providers. They come to your house. They're with you. They're with your child. Your children looks out the window waiting for them to come when they know they're coming, because
Right.
they're their best friend.
That's excellent.
And to have that person to go with them to those meetings, and to have like, oh, there's somebody here with me who understands me and my child, and you know, I don't know the rest of these people and what's happening right now, but they know me and they know what's going on. It's just such a security for them, and that's huge. That's a really big thing to have.
Definitely. Now, what happens to a child after 3?
Well, federally, we in early intervention are required to assist families in 3 major transition activities. Every child and family has a transition plan before they're discharged and transitioning out of early intervention. And that plan, which is part of the individual family service plan, really highlights the activities that the EI program is going to do to support the family in a smooth transition. The other component that they're federally required to do is to, if a child is potentially eligible for Part B services, which are special ed preschool services, they hold a transition planning conference, and the family and the other next step services are invited to that conference to support the transition and to talk about what the next steps might look like. And then we are also responsible to notify the LEA of any children that are potentially eligible, so they know the number of children that might be coming up in their district, so they can have appropriate classrooms available for children that are transitioning into public preschool settings.
Does getting evaluated affect a label on the children? I mean, do they have that label throughout their lives, or
This
how
comes
does
up
that
a lot
work?
in my toddler class and when we're referring parents to call early intervention. And what I like to tell parents is Harvard could care less if early intervention was coming to their house at 1 or 2 years old. There's no negative association to having early intervention at any point.
I would agree. There's no stigma at all. And we're finding that in Massachusetts, it's so universally known. We don't really have to do a whole lot of child find activities because people know it's a family-centered supportive service. There's no downside to it. There's no cost to families. There's no stigma. And so that, I think, kind of helps families to think about enrolling, and that's why we have no problem in Massachusetts really identifying kids that are potentially eligible for early intervention.
I think years ago there was some stigmas involved in having a diagnosis, an actual label to what a child was going through. But you also have to understand that years ago the education system was different. It's so much more advanced now. You know, kindergartners, when I went to kindergarten, you were learning to cut and learning to glue and learning to stay in a line when you walk to the bathroom. And now it's so much more. I mean, they're doing addition, subtraction, they're reading in kindergarten. So I feel like if you had a delay when I was a child, you would struggle, but you could get through it. The teacher would have to help you a little, but you could get through it. Now, being an educator myself, if you're struggling, it's going to be a long uphill battle, and not having that help just makes it that much harder for the families and the child. So it's just so crucial to identify when there is a struggle, when there is a delay happening, and to address it as quickly as possible. I think people from my generation are still on the fence on coming over that and still remembering when there was stigmas involved and you didn't want a diagnosis. But we label everything. We label a cup, and a flower because they do different things. They are applied differently in life. And I think getting a diagnosis is the same thing. Knowing that my child's autistic sets us on a different path, but it's a helpful path to know, because otherwise I feel like you're a little lost and you don't know how to help your child appropriately. So I feel like labeling is important, and it's done well.
Now, what is the best advice that you can give a parent who just started this disability journey? What's the best thing that you can tell them?
I would say connecting with another parent.
I think that's very true. I think when you're first getting a diagnosis, everything feels microscopic. You're focusing on that one problem, that one issue, that one piece that you don't understand. And I feel like that's where early intervention is so great, because they're looking at the big picture, your whole family, your whole child, everything about them. And I feel like it's very hard in that moment to step back and remember that this is a whole child. It's not just one little piece of them, but just taking deep breaths and knowing that you have the support to help you. And I think that's the biggest thing, is knowing that there's support through early intervention, through a parent like myself who's been through this and has a happy, beautiful child who's thriving. I feel like that's a huge asset for any family.
Now, what's the number that people can contact for early intervention services?
There are two ways that families can identify which early intervention program covers their city or town. They can go online to www.familyties, all one word, .org, and that will bring you to the Family Ties website. They hold our central directory. If you click up in the right-hand corner on early intervention, there'll be a listing of all the early intervention programs by city and town, so you can search that way. Or a family can call the Family Ties number, which is 1-800-905-TIES. Is that correct? Did I get that right? And they can talk to somebody at the Family Ties program, and they will direct them to the local early intervention program. And then they can just call directly themselves. They don't have to have a referral from a pediatrician or any other primary care physician, and they can start the enrollment and the referral process.
Great. Well, I thank you both for coming today. It was very informative.
Well, thank you for having us.
You're
very much.
welcome.
Thank you.
Glad you came. Early intervention can help a child with developmental delays or disabilities by incorporating sensory integration, communication, fine motor skills, and more into daily play. Parents are the key to helping their child succeed. Till next time on your Disability Connection.